I want to go back to testosterone replacement again because I left out a few things. So we talked about the ideal way of applying testosterone or basically replacing it is going to be transdermal. Again, there are all sorts of pharmaceutical gels. I think that you've probably heard a lot of them are called androgel. There's others. Again, there's also compounding. So we use a compounding pharmacy to create the exact ideal dose for that patient, and again, it's a gel or cream and applied transdermally to the skin. However, there's also another method, and it's called pellets. You may have heard of it or not. So this has been around for a while. There are other companies that have been doing this for a couple of, at least a decade or more. So pellets are basically placed in the subcutaneous tissue, just underneath the skin, in the fatty part of our tissue, and it's going to be in either one side of your hip or the other. It's basically right above the buttock area. And they last, and they're tiny, they're very small. Most of the time, the average length of time that you're going to have adequate or testosterone levels and improved symptoms is anywhere from 4 to 6 months. Why women like this better? Well, it's like a one-time placement. You don't have to keep applying something every single day. With testosterone replacement, there's the gels are topically placed, and you have to be careful that you don't touch children, animals. Soon after you want to make sure it's completely dry. So that's kind of something that some women prefer not to have to deal with. It has been found probably much higher improvement in symptoms of libido when it comes to using the pellets. So that is one other method or route that I forgot to mention. Again, I also have websites that have information that I can give you on actually pellet therapy. So that is something I'm happy to provide. It gives way more details for you.